Welcome back to Doc Fats. You know, our deal here, breaking down tough sports med topics and making them clear and actionable for you. Today, well, we're going deep on pain management,
Definitely crucial stuff and always changing too.
for sure. And to guide us today, we've got this awesome recent consensus statement from the International Olympic Committee, the IOC.
Yeah, they did a great job focusing on evidence-based stuff, which is what we like.
Big time. Now, you're probably thinking pain management. I do that all day, every day. But trust me, this deep dive, it's going to give you a fresh perspective. We're going to be talking about pain without injury and get this injury without pain,
Yeah, you got it. It's not always so straightforward. It's not like one always equals the other.
which makes these tricky, right?
Uh,
Both diagnosing it and treating it.
uh,
Okay, so let's get started. How does the IOC actually define a sports injury?
They define it as any new or recurring musculoskeletal complaint that happens during competition or training. A&D requires medical attention. And it's that requires medical attention part that's important.
So not just like some post-workout soreness. We're talking about something that needs a pro to look at it.
Exactly. Because even those little things, if you don't address them right, they can turn into big problems for elite athletes. Career-ending stuff.
And that takes us to pain types. The IOC talks about nociceptive neuropathic and this interesting one called nociplastic pain.
Yeah. Got to understand those differences if you want to treat it right. Think of it like this nociceptive pain. It's your body's alarm system going off. Usually from actual damage like a sprain or inflammation, those nociceptors, they're saying, hey, something's wrong.
Like a direct line from injury to the brain saying, pay attention.
Yeah.
So what about neuropathic pain? What makes that one different?
Well, neuropathic pain comes from problems within the nervous system itself, like faulty wiring instead of a clear signal, burning, tingling, or shooting sensations, even without an obvious injury.
Sounds super tough to deal with. Do you see that a lot in elite athletes?
Yeah, we do things like nerve entrapment or complex regional pain syndrome can definitely happen to athletes. And it's especially common in Paralympic athletes, those with spinal cord injuries.
Now, this nociplastic pain, that sounds complicated.
It is. It's not caused by direct tissue damage or nerve injury. It's more about changes in how the nervous system processes pain signals. Like the volume knob on your pain perception is turned up even though the original signal isn't that strong.
So the body is basically amplifying the pain even if there's no physical reason for it. Wow, that's crazy.
It is. And it helps explain why pain can stick around even after an injury is healed or why someone might have a lot of pain without any obvious damage.
It really changes how we think about pain, not just directly linked to the injury anymore. It's way more complex than that.
Yeah, and for athletes, it means we got to think about psychological and social factors too. Those can really affect pain perception and recovery.
So for everyone listening, think about this. How might an athlete's training, competitive pressures, even their support system, how might those impact their pain? It's pretty fascinating when you think about it.
It really shows why we need a holistic approach to pain management in athletes, something we'll dig into more later.
Before we get to that, let's talk diagnosis. The IOC statement makes it clear. Pain and injury, they don't always match up perfectly.
Nope. You can have lots of tissue damage without much pain. And the other way around, too. Bad pain without any obvious injury.
Must make diagnosis tough, especially with athletes who always want to compete, even when they're hurting.
For sure. That's why we can't just rely on imaging or exams. We got to understand their individual experience. Ask them, what does your pain feel like? Where is it? When is it worse? What makes it better? Those questions can tell us a lot more than just what the injury is.
It's about seeing the athlete as a person, not just a bunch of body parts.
Exactly. And I challenge all our listeners to think about this. What questions do you ask your athletes to really get their pain? What are you looking for in their answers?
That's key for giving the right care. Yeah. Tailored to the individual. All right, let's move on and explore the different ways to manage pain that the IOC recommends.
Let's talk management then, starting with those non-pharmacological strategies. They're the foundation, really, especially early on and for long-term control.
I'm really glad to see the IOC putting so much emphasis on that biopsychosocial model.
Yeah.
It's not just about the physical stuff, You got to think about the athlete's thoughts, emotions, their whole social world. It's holistic.
Absolutely. It's a big shift. We're saying pain is an output of the brain affected by way more than just a messed up knee or whatever. For athletes, this means looking at their training, their stress levels, who they've got for support, even their beliefs about pain.
Speaking of beliefs, what about all those things, modalities and massage therapies? Do they actually work? I mean, scientifically?
Now, that's an interesting one. The IOC statement actually talks about that. And, well, The evidence is mixed, to say the least. Some athletes might feel better for a bit with things like ultrasound or massage, but the research says it's usually temporary. Probably not because of anything specific to the treatment.
Not specific. What do you mean?
Well, think about the placebo effect.
Right.
If an athlete thinks something will help, they might feel better, even if the treatment itself doesn't really do anything to the pain physiologically.
So it's not like those modalities are useless,
Hmm.
but we shouldn't expect them to be miracle cures.
Right. We need to be honest with our athletes about that. Modalities might help them feel better temporarily or cared for, but they're not a long-term fix for pain.
What does have good evidence then? Where should we be focusing our efforts?
Movement and exercise, even with chronic stuff like osteoarthritis or fibromyalgia, research consistently shows exercise helps manage pain.
I love to hear that. Exercise is already so important for rehab, but knowing it can actually change how we experience pain, that's huge. How does that work?
It's not just about getting stronger or getting your range of motion back. Exercise actually uses the body's own pain relief systems, releases endorphins, those natural painkillers and mood boosters, and helps with inflammation too.
Like our bodies have this built-in medicine cabinet, and exercise is the key.
Exactly. And it works for pretty much everyone. We can tailor exercise plans to each person's needs and abilities. It's a long-term solution for managing pain.
We should mention sleep and nutrition too. Those are important.
Absolutely. You're right. Bad sleep makes you more sensitive to pain, and a good diet helps reduce inflammation and helps your body heal. People often forget about those.
And then there's the mental side of things too, like cognitive behavioral therapy, CBT. That seems especially important for athletes with all the pressure to compete.
It is. CBT can be really helpful. It helps athletes see and change negative thoughts and behaviors that might be making their pain worse. Gives them tools to deal with pain and setbacks mentally.
So it's not just about the body, it's about the mind too. That's pretty cool.
And it fits perfectly with the IOC's idea of using a team approach to manage pain.
Okay, let's talk about medication, the big one. The IOC guidelines are pretty clear about how to use them safely and effectively.
Yeah, and the main message is this. Medication should be part of the plan, but not the whole plan. The goal is always to use the lowest dose that works for the shortest time possible.
Got to protect the athlete's long-term health, right?
Yeah,
We don't want to just mask the pain to get them back in the game and then create bigger problems later.
exactly. The IOC guidelines give specific advice based on how bad the pain is and when the athlete wants to return to play. For example, for same-day return to play, they don't usually recommend opioids.
Why is that? Opioids are strong painkillers, right?
True, but they can make you drowsy and mess with your reaction time. Not great for athletes who need to be on their game. Plus, studies haven't shown them to be better than NSAIDs for pain relief in those cases.
So in those situations, the risks are just too high. It shows we can't just throw meds at the problem without thinking about the consequences.
Now, the IOC does say there might be times when opioids are okay, when it's not for same-day return to play. But those decisions need a lot of thought about the risks and benefits, open talks with the athlete, and everyone agreeing on the plan.
Transparency is key, right?
Yeah.
Athletes need to understand the risks even if it means delaying their return. Their long-term health is what matters most.
Which brings us to a tough situation. What about the athlete who just isn't recovering the way they should, when the pain sticks around even after the injury has healed?
I know. That can be so frustrating for everyone, the athlete and the doctor. We start questioning everything, the diagnosis, the treatment, even whether the athlete is doing their rehab. But the IOC statement gives us a good way to think about it. It says that pain doesn't always perfectly match what's going on with the tissues.
Right, pain comes from the brain, and it's affected by a lot of things. Thoughts, emotions, even beliefs about the injury. We call this the biopsychosocial model of pain.
It's a good reminder that we're treating a whole person, not just a bum ankle or hamstring. And this is where that pain variation figure comes in, figure 1 in the statement. It shows how pain can change over time because of all these different things.
It's not a straight line, it's always changing. And that's why it's so important to keep talking to the athlete and checking how they're doing, especially if their pain isn't going as planned. We have to ask ourselves, what else could be causing this pain?
The IOC gives us a checklist to help with that. It covers things like changes in the pain, how bad it is, where it is, what it feels like, even what the athlete expects about recovery. It helps us think outside the box.
And in those tricky cases where recovery is slow or complicated, having a psychologist on the team is really important.
They can help the athlete with the mental and emotional stuff that comes with long-term pain. Fear of getting hurt again, anxiety about their performance pressure from coaches and teammates.
Yeah, A psychologist can help them cope with all that and get back on track.
Okay, let's wrap up this deep dive by talking about the ethical side of pain management. Always a tricky subject.
It is. It's about finding that balance. The athlete wants to compete, they want to push through the pain, but we have a responsibility to protect them in the long run.
Exactly. We want them to achieve their dreams, but not at the cost of their health. It's a tough line to walk.
And the IOC's medical code gives us some guidance. It says athlete health comes before winning. We have to look out for our athletes, even if it means telling them to rest or pull out of a competition.
Informed consent is so important here. But how do we really get informed consent when athletes are under so much pressure to perform?
By being honest and open, we have to explain the risks of playing through pain, both now and later. Make sure they understand they can say no, even if it means missing a game or a big event.
It's about giving them the power to make choices that are right for them. And sometimes that means choosing health over their sport. It's a hard conversation, but it's one we need to have.
Definitely. And it all comes back to making decisions together. We're a team with our athletes working together to find the best way forward.
Before we wrap up this deep dive on pain management, got to talk about anti-doping rules.
You're right. Huge deal for any sports med doc working with these elite athletes.
For those who might not know, we're talking about WADA, the World Anti-Doping Agency. They have this prohibited list. Tells you what substances and methods are banned in sports.
Keeps things fair and protects athletes, too.
And you'll find a whole section on that list for narcotic analgesics. That includes those strong opioids we talked about, like morphine and fentanyl.
And it's not just opioids either. We're seeing cannabinoids on there now, too. Those are getting more and more popular for pain.
Right, so even if something helps with pain, it might still be banned in competition.
Exactly. Tough spot for athletes who really need those meds for a medical reason.
It is super important to be upfront with athletes about that prohibited list and any meds they're taking. If they need a banned substance for medical reasons, they can apply for what's called a TE, a therapeutic use exemption.
Yeah, the TUE lets them use the banned substance. But they have to jump through a lot of hoops.
It's a strict process. Lots of paperwork, medical records. Got to prove that not using the medication would be really bad for their health.
And that it won't give them an unfair advantage. Just gets them back to normal, so to speak. Level playing field for everyone.
So it's finding that balance.
Yeah.
The athlete's medical needs and keeping things fair in sports.
Yep. That's why it's so important for sports med docs to really know WI's rules and how that TUE process works.
Okay, we covered a lot today. Let's do a quick recap for everyone listening.
Big takeaway, pain management for these elite athletes. It takes a team effort. Got to think about the whole athlete, mind, body, their social situation, everything.
See the whole picture? Pain and injury, they're connected. But it's not always a simple equation.
And we can't just believe everything we hear about treatments. Got to be critical, especially with some of those popular modalities.
If meds are part of the plan, use the lowest dose that works for the shortest time. Athletes' long-term health is what matters.
Can't forget about movement and exercise. Those are key, and we probably don't use them enough.
Most importantly, honest communication, making decisions together. Strong ethics, always putting the athlete first.
Give athletes the info they need to make good choices about their health and their career.
To everyone listening, I hope this deep dive gave you some new ideas and stuff you can use when you're working with athletes. Pain is complicated, takes a multi-pronged approach.
Keep learning, keep questioning, and always look out for your athletes.
Thanks for joining us for this deep dive on pain management in elite athletes. We'll be back with another evidence-based look at sports medicine soon.